Thank you. It's a pleasure to be with you. Is this working? Is this working now?
A little bit.
I'll be eating it. How about now? Uh, is there a button? Now? Better? Better? Okay, got it. Um, I'm Bob Israel. I'm happy to be here and glad for the invitation. And if I heard Kevin correctly, thank you, Kevin, for your remarks. Uh, a number of the programs coming up will help your sleep immensely. Mindful meditation, all right, that's coming up soon. If you practice that, you'll be right on target to being perhaps better prepared to enter the bedroom, enter your bed, and relax and be more likely to fall asleep. I endorse it wholeheartedly. I took a course similar to that in 2002, and it changed the directory of my life, making it much more calmer and much more in the moment, and it can help you no matter what you're dealing with. So I endorse that tremendously. And a number of the other programs resonate with me very well. And I'm going to put another endorsement in for basically alternative medicine, lifestyle medicine. And that is, I think, the buzzword now. And I'm happy to say Jane Dorsey, the nurse practitioner in the sleep center where I worked, will be emphasizing that. That's the area she works in. She still works at the sleep center, but has this great interest in alternative medicine and lifestyle medicine in particular. So those programs will help you no matter what you're dealing with. And I'm sure being this program about sleep, it will only enhance your ability to sleep better and function better. So I'm very happy to hear those programs are on the docket for you guys. Just as a brief introduction of myself, I've been in Rochester since 1975. I trained in medicine in New York City, receiving my diploma from the State University of New York Downstate Medical School in 1967. I did all of my training in New York City. I'm not a big city person. I grew up in a small town in Connecticut, rural Connecticut. And so New York City was an eye-opening experience. And I was happy to be there and happy to leave there. So here I am in my favorite place in the world, Rochester, New York, where snow doesn't stop anything. I was in the armed forces during the Vietnam conflict, and I was stationed stateside. I was stationed in Virginia outside of Washington. That's another entity unto itself. One, just whiteness on the ground would paralyze them. They would say, I can't go out, I can't drive. And you would get off from work, it was a whole big deal. And it wasn't even a coding, it was like crazy. But I'm happy to be here in upstate New York. I'm going to do something different, I think, very much different. And I have a presentation. I jotted down the things I want to say, but I don't want to say them. I want you to ask questions. And I'm going to open the floor up for questions, and we're going to see how many questions you cover that are on my list. And I want to really get you to be comfortable with the things that are concerning you answered in this hour and a half, or what's left of the hour and a half. I want to introduce Jane Dorsey, who I worked with for almost 20 years at the Sleep Center. She was our nurse practitioner. I want her to give a short introduction of herself, if she would.
All right, thanks, Bob. Hi, it's nice to see everyone here. I'm so glad the snow didn't stop folks from coming out. Bob and I go back to 2000 when he came over to do full-time medicine, along with his pulmonary practice. I'm a nurse practitioner in family medicine. Trained at Rochester, Master of Science there, at SUNY Binghamton, Bard College. Lots of interesting experiences. But now I'm a diplomat of the American College of Lifestyle Medicine because this new way of thinking, it's not so new, it's holistic. It's the process of thinking about a person, not just as a composite of different problems where you see a neurologist and a neurologist, but everything overlaps, especially the GI system, the gastrointestinal system, and our brains. Everything is interwoven. And one of the little handouts that's on front and back, information that you could use if you'd like to go online locally. There's a Dr. Ted Barnett, a radiologist in traditional medicine, lifestyle medicine, Rochester Lifestyle Medicine Institute, and rocklifemed.org. They have a lot of free information, and they just recently had a Zoom online lecture, and it's accessible. It's free. You can look on their website. They had a gastroenterologist who was talking specifically about Parkinson's and disorders of the bowels and how it relates to the development of Parkinson's. So there's a lot of great information. Maybe sometimes it seems like too much, but a little bit at the right time. Mindfulness is the bottom line. Being aware, being able to calm our nerves, and breathe deeply. So today, as Bob said, we're going to try to entertain questions and see where your questions hopefully give you some information that's useful.
I'm going to start out and then then see what kind of questions come from the floor. This page, the second page of the handout I gave you, rules for better sleep. This is probably the most important piece of information that we're going to talk about, because as a show of hands, how many people have trouble either initiating sleep, maintaining sleep, getting enough sleep, and feeling vital in the daytime? How many people have trouble? No, anybody. Actually, I may as well raise my hand also. So these 11 bullet points, if you will help. And some of the programs that you've heard about already will help a great deal. But I want to basically emphasize a few of them. Loud noise. Quiet is important. And if it's not quiet in your environment, I advocate earplugs or getting rid of the noise. Warm rooms, a no-no. It's very difficult to sleep in a room that's warm. It's not physiologic. Ideal temperature is something I hate, 66 to 68. Cool is the word. Be cool. You'll sleep better. Hunger doesn't mean you eat before you go to bed. That's a no-no. But a light snack wouldn't hurt. Perhaps a half hour, an hour before bedtime. But you do not want to go to bed hungry. Caffeine. Who in this room does not have caffeine in their life? Wow. I didn't think I'd see a hand, but good for you. But for all of us who do drink caffeinated beverages or take caffeine in any form, it's very interruptive. The mechanism of sleep is interfered with tremendously with caffeine. One of the two components of sleep relates the time we're awake, number one, and relates to our metabolism. So if you wake up in the morning and had a good night's sleep, for every hour you're awake, your body is burning energy and creating, how would I say, waste products, or the result of our energy burning. You've heard of ATP, adenosine triphosphate, the thing that gives us our energy, that's metabolized in the brain. It builds up in the brain, and as that level builds up, we get sleepier and sleepier. The longer we're awake, the more this is produced, and the sleepier we're going to get. And that's the way we're built. If you take caffeinated beverages, that caffeine vies for the same site that the end product of metabolism is aiming for. And therefore, it's blocking our signal to be tired, to be sleepy in the brain. And so if you have caffeine in the body, it's going to block your ability to feel that sleepiness that should be occurring from our everyday burning of energy, if you will. And caffeine in the morning is probably okay. As we get closer to bedtime, it's probably not okay. And if in the evening, I would say it's going to affect your ability to fall asleep for sure. So a caffeinated beverage is okay. You might want to go decaf as you get to the latter part of the afternoon and evening. The second thing that interferes with our sleep is bright lights. The other mechanism of sleep, besides the buildup of adenosine, is bright lights interfering with sleep, interfering with melatonin secretion. Our eyes are the signal to turn off melatonin. Melatonin is the sleep hormone produced in the pineal gland of your brain and is turned off by the light coming in from our eyes. So right now, my light going to my brain has turned off the melatonin. The switch to turn it on occurs at nightfall. So if I have bright lights in my bedroom or in my house or I'm exposed to it, or if I'm out of doors in the summertime, the melatonin is suppressed. Normally at dark, it's going to start to be secreted, more melatonin, setting the stage for sleepiness. So that, together with the buildup of ATP from our metabolism, makes us sleepy, and that's why we go to bed when we go to bed. And you can interfere with that greatly if you have in your home blue wavelength light. You've heard of that perhaps. We have blue wavelength eyeglass filters. They're important. If you have what everybody has in their home today, computers, TVs, you name it, we're exposed to this light that's going to inhibit our natural melatonin. So these are two things you can do to very much improve your ability to fall asleep in the beginning of the night. Alcohol. Alcohol by itself is not bad, but alcohol before bedtime, if you use alcohol and think that it's going to make you fall asleep, you're correct. Alcohol will initiate and help you to initiate sleep, but alcohol also disrupts the sleep, causing you to have many wake-ups throughout the night when you have alcohol in your blood. You think you're asleep, you think you're sleeping deeply, you're not. You're getting
To library patrons, with the owner of a black Nissan Sentra, please report to the circulation desk. Your car is parked blocking the crosswalk and needs to be moved. A black Nissan Sentra. Thank you.
So again, on alcohol is going to inhibit your steadiness of sleep. You'll have multiple wake-ups. It suppresses REM sleep or dream sleep. And so a cocktail at a reasonable time in the evening might be okay, but if you have a blood level of alcohol at bedtime, it's going to disrupt your sleep. Even though you feel it puts you to sleep initially fast, which it does, it's not going to be good sleep. Smoking, I hate to be such a bad guy, but all these habits are not good. Smoking is not good. I also practice lung disease, and I can tell you for sure it's not good. But tobacco will also interfere with sleep. So I think we covered the major inhibitors of getting a good night's sleep, and perhaps some of the things you can do to adjust in that regard. So I'm going to, with that, let you kind of direct this talk. And I'll open it up for questions, and if you don't have any, I'll keep talking, but okay.
Dreaming in terms of being that dreaming in terms of being very vocal or active, arms flying, things like that.
Let me ask in the room, a show of hands, how many people in this room have, during their sleep, the, how would I say, the maybe the thrashing about or vocalization, as, in other words, activity. So you're asleep. Okay, okay. Perfect, not perfect, but that's what I would have expected. What you just described is called a REM sleep behavior disorder, RBD. And what it stands for, REM sleep is a phase of sleep when we dream. And I'm just going to give you a little bit of a discussion of the physiology of sleep. So when you sleep in what we call a sleep cycle, okay? It's like taking a car and going to the store. Who here remembers how to drive a standard shift car? Yay! So you'll get my illustration. So I'm going to the store. I get in my car, start my car, first gear. I'm going about 15 miles an hour, second gear. Going about 30 miles an hour, third gear. That's good. That's what sleep is. You fall asleep in stage 1, it's light sleep. You go into stage 2 sleep, middle sleep. We get a lot of sleep in stage 2. And then if you're cruising the highway, you go into stage 3. That's deep sleep. So there are 3 stages. That's non-REM sleep. And then the final stage, if I'm going on a long trip, then I shift into REM sleep. And REM sleep is dream sleep. That's when we dream. And that is how sleep progresses. We call that a sleep cycle. And a sleep cycle occupies 60 to 90 minutes. That's the time of a cycle. Then we have maybe a wake up that we're not going to remember, and then we go into the next sleep cycle of 60 to 90 minutes, and the next, until we finally wake up. Now, you go from stage 1 sleep, stage 2, stage 3, and then REM sleep, dream sleep, in that order, usually. If something disturbs your sleep and you have a wake up, let's say you're in stage 2, you start over again, just like if I hit a stop sign and I'm driving my car. You shift back into stage 1, 2, etc. Now, these cycles of sleep are different in the beginning of the night and as we progress through the night. So in the beginning of the night, you're sleeping into stage 1, 2, and that's when you get a lot of deep sleep, stage 3, in the beginning of the night, maybe the first or second sleep cycle of the night. Don't get much dream sleep, REM sleep. You don't get much of that. The next cycle, we get less deep sleep, a little bit more REM sleep. And as we progress through the night, the final cycles of our sleep, we get a lot more dream sleep. So that is why many times we wake up and we remember our dreams, because it's more common as we go through the night. As a show of hands, how many people dreamt last night? Okay, for all those who didn't, you did. Why didn't you think you dreamt? Is because you don't remember a dream if you don't wake up while you're dreaming. So, there. Yes.
back to the previous question that was asked, is there anything you can do about that vivid
Oh, yeah.
acting out of dreams and so on?
Yeah, we're getting there. Yeah, yeah. So
Sorry, I was on a hurried schedule.
I'm sorry for the long-winded answer, but this is also teaching you what sleep is. So getting back to acting out a dream is really what was asked. And it's called a REM sleep disorder, a REM behavior disorder, if you will. And it's, how would I say, in the population at large, I think it's maybe 15% of people might have this occasionally, maybe. In the people in the with Parkinson's disease, it's like 60% of them have this REM behavior disorder. And it can occur years before you develop symptoms of Parkinson's disease. It's very, very common. And it's very, very treatable as well. So you described very well exactly what a REM behavior disorder is. It's vocalization and movement. In other words, in REM sleep, your muscles are totally paralyzed except for your breathing muscle. So when you're in dream sleep, those muscles are not moving. You couldn't move your arm. And if you wake up too soon from REM sleep, you're going to think you're paralyzed. You'll have what we call sleep paralysis because they are paralyzed from the dream sleep. So initially, you might not be able to move an arm or a leg. It's perfectly normal. But in Parkinson's disease, there's activity of those muscles, and that's the REM behavior disorder. So there's vocalization associated with limb movement, and it can be dangerous, actually. You can get hurt because you can fly out of bed. And it's very treatable with medication. So there's the first line well, there's two medicines we use. I don't know if any of you are on clonazepam or Klonopin for this. Show of hands if anybody's on that. And melatonin is the other medication that's often used. Melatonin for sleep, I told you melatonin is a natural product. We produce it, and that's what helps us to get to bed. And it only is produced in our body in darkness or not the blue wavelength light. So dim lights are better in the evening. And melatonin, our body produces maybe 0.3 milligrams. Listen to this, 0.3 milligrams. Small or less. Melatonin starts, when you buy melatonin in the market, it starts at 0.5 and it goes up to 10, 3, 5, 10, and higher milligrams. Well, in the REM behavior disorder, we need a lot of it. We usually use big doses, 12, 15, 20 milligrams, something I don't advise anyone else to ever use. But for this particular condition, you might need a much higher dose than what would normally be recommended. Those are the two drugs that usually help to control it. And if not controlled, we use mechanical means. Sleeping in I almost said a sleeping bag. I almost said something else. But sleeping in a sleeping bag could help to prevent some hurt, falls. Having an alarm if you're getting out of bed so you wake up or somebody in the house wakes up to help you. But there'd be measures to put in place so that you wouldn't get hurt or harmed.
Trying not to become overtired. Definitely not having alcohol. And the idea about having a snack is a double-edged sword because you want to make sure you're not hungry by eating earlier in the day and eating fiber. But when we snack too close to bedtime in certain foods, it makes more activation of the gastrointestinal system, and that can interfere with those cycles of sleep that Bob's talking about. So when there's REM behavior disorder, the normal suppression of our muscle tone, our skeletal muscles, our arm, leg, and throat muscles, it's not happening. REM behavior disorder means these muscles are activated, and the dream usually is something where we're stressed. We want to limit the stressors before bed, in a couple hours before bed, either relaxation, not watching scary things on video or fast-paced video, and even what we read. We've had people who couldn't even read their favorite crime novels right before bed because it was too activating for their brain. When they settled into sleep, they were more prone to this thrashing and acting out of dreams. Dreams can come from all corners of the brain, so caffeine can certainly be a problem. And as Bob said, it lasts about 12 hours on the adenosine receptor. So that means we're not going to get into different stages of sleep as smoothly. Really, we need to think about caffeine as in the morning only, a good 12 hours away from bedtime. We can fall asleep with caffeine, but the quality of sleep won't be good. And we're more likely to have that activation during REM sleep that we shouldn't have. The muscle tone is too active, and we're all over the place and possibly injuring ourselves. Just wanted to add that in.
Thank you.
Is it okay to wake the person?
Oh, absolutely, absolutely, absolutely. Waking the person, A1, to prevent harm. If the medicines aren't working or if they're not on medicines, absolutely. Yes.
You mentioned two medicines. One I'm familiar with is melatonin, but what was the other one?
Clonazepam. Clonazepam is a medicine. It's like Librium. It's a medicine that works really wonderfully for this condition, and
Which is better, melatonin?
whichever works. That's the best one.
Yes.
One's a prescription. Yes, yes.
Clonazepam can have side effects.
Yeah, we don't like to use clonazepam usually. It wouldn't be a first choice for other conditions, but for this, it works.
Questions. One is how early in the evening melatonin to help with the sleep. Secondly, how early in the evening to stop having light activity.
Good question. I would say for blue light, you want to be conscious of it as the outdoors turns dark, because melatonin starts to be secreted. No, when it's dark, that's when it starts to be secreted. So if you're in bright light, your night hasn't started, and melatonin builds up over time, maybe a few hours before bedtime. So I would say you might have to experiment, but usually evening is when I would be cautious of bright light, blue light, for sure. And as far as when to take melatonin, a couple hours before bedtime is reasonable. 1.5 hours is reasonable. Right, the time you're going to bed, not reasonable, because our body starts producing it and putting it out in the circulation as it's getting dark. So think about the outside light as your cue and also the time you want to go to sleep. When do you want to be in bed and fall asleep? So as a general rule, maybe 2 or 3 hours before your bedtime would be reasonable. Oh, anything with tryptophan. Tryptophan. It's an amino acid. It's in tuna fish, turkey. Oh, I know. I know I'm going to I can't look. She's so healthy. What foods to eat to get sleepy? Think Thanksgiving. I'm going to have Jane answer this as well, because Jane's, can I say? She's vegan. And so she's more strict than I am, let me say. So let me have her, if you were vegan, what would you do?
No, it's not the food, it's the timing.
Oh, okay.
And tryptophan, you'd have to eat a wheelbarrow full of tryptophan
That's Thanksgiving.
Yeah, and it's also with Thanksgiving, it's usually all those carbohydrates and sugars and gravies, stretching the stomach. We're so full, it's like we're kind of lethargic because of that. So the idea is that we're not going to eat a food or drink a tea that's going to make us go to sleep. We're going to prepare the brain and the body for sleep, like turning off the really bright light, that fast-paced video game, that scary movie. Really, it would be good to have screens off about an hour and a half before bedtime. If we read at night and it's from a screen, think about trying to read from a page at night. But in terms of a snack, eating well in the morning, eating fiber, believe it or not, is what helps our gut get on the right track, and it slows our absorption down. So eating well in the morning and the afternoon, having a light meal at supper time, and getting enough of food we need. Carbohydrates have gotten a bad rap, but think, oh, cookies and milk will help me fall asleep, but really, it can cause more irritation to the gut and more blood flow to the GI tract when we're really trying to settle down and not have a lot of activity. So the short answer is really nothing. Just recommend sleep for foods to help us sleep. But having a good meal during the day fills us up at lunchtime or late supper, and try not to snack in the hours before bed. So I even tell my patients in sleep medicine, try to avoid drinking water in the hour before bed, because they lay down and go to sleep, and the water and stomach acid mixes together, and that acid and water silent reflux. Even if we take acid reflux medicine, can still cause quite a bit of damage and interfere with us having that nice transition in and out of all the different stages of sleep. Stages of sleep that restore us. It's not like one stage is better than the others. It's getting that whole package. So the hours before bed, not really snacking. But if you have a favorite food that you want to have it after lunch or have it at around 4 p.m. That ice cream or that chocolate or something like that. Chocolate doesn't have a lot of caffeine, by the way, unless you're eating very concentrated dark chocolate in a large amount. But it's still somewhat activating. So we don't recommend that chocolate on the pillow like you might get in a fancy hotel. Not so good. Save it for tomorrow after lunch. So does that answer the question about the snack? Sorry to be a dead weight, but chamomile is a big favorite, and it can be relaxing. Some people, it stirs up their ragweed allergy, believe it or not. That's knowledgeable about. Mint is often combined with many herbal teas. Mint can be soothing and calming, but it can also cause a backflow. Gastric acid reflux can sometimes get worse with mint products, even mint toothpaste. So that's something to be aware of. And as they say, silent reflux, we don't even know it's happening. Things have relaxed enough, whatever's in the stomach, even a little swallow of saliva, might start relaxing, or the muscles might be relaxed to the point where that comes up. We have a spasm, we don't feel it, we don't feel heartburn, but it can come all the way up into the back of the throat or even the back of the throat. So I even tell folks with sleep issues, maybe have mint earlier in the day if you're really partial to tea that has mint in it. A lot of herbal teas, they mix the mint in sleepy time. Oh, this will help you sleep tea. Well, use it to relax later in the day, but I wouldn't have it within a couple hours of bedtime. People who have medicines that they take at bedtime, we recommend that they take. Maybe try to take them when you're sitting up a good hour before bed. Oh, yeah.
How do you break the what this and they're exhausted in the morning and they end up sleeping on and off all day long. Never really rested enough.
Well, one key thing to do is not remain in bed awake during the night. After about 15 minutes of trying to go to sleep, just sit up, go to a chair, don't interact with pets, people, snacks, or electronic devices. You're in that chair with a lamp to read something really boring from a page, not a phone, no electronic devices. It's a gradual process to change to re-entrain the circadian rhythm. It can take time, but it can be done. And that's something that Bob and I talk a lot about. Cognitive behavioral therapy for sleep is an entire approach to helping people get their sleep back on track without relying on medication for umpteen years. Medicines have their uses in terms of getting to sleep, staying asleep. But in the long run, we want to fix the machinery, fix the engine, get under the hood of the car, and the problems that brought the person to not being able to sleep at night are complex. That's true. And some of them may have started in high school, sleep deprivation, um, work schedules, all kinds of reasons. Raising children, being vigilant, taking care of someone. That vigilance doesn't just go away when the person we are taking care of doesn't need us to care for them. The brain can learn how to sleep again, the brain and body. When you get to bed, you can't fall asleep. 15, 20 minutes go by in a quiet, dark room. Get up, no interaction with other people, snacks, electronic devices. Thirsty, swish water around in the mouth. Get it out, have a jar next to your water. After 15 minutes in bed awake, sit up in a chair and do some really boring reading materials that you've assembled ahead of time. You agree?
I'm very agreeable, usually, but not with the food thing. But, and I suffer because I do it, so don't listen to me. Listen to Jane. As far as when you can't sleep at night, I agree. You should get out of your bed. Don't associate the bed with insomnia. Just get out of the bed, go in another room. It will pay big dividends, even though you might be tired the next day. And one of the things, I think Jane will agree on this. I'm not sure, but I hope so. But one of the things that really sets the stage for sleep and helps you to get back on track is something that we do in the sleep center at times. We sometimes send our patients to our insomnia clinic, but one of the hallmarks that you can try at home, I do this sometimes when I'm off schedule, is if I can't sleep, I'll get out of the bed, out of the bedroom into a quiet room and just do something mindless for a while and then get back in bed. But the key to getting back on track is having a set wake-up time every day, the same. If you get up the same time every day, even though you have a bad night, you're going to reset. But if you sleep in, you're going to get all off cycle. So that would be my big take-home message. Get up at a set time, even if you've had a bad night, and then it will self-correct over time. And if you need help, also we have a psychologist at our sleep center who really just does that. And
Yep, Dr.
you want to comment on that?
Just going to say, if you don't have to sit down. When you can't sleep, you get up, reading. Maybe you get tired, you go back to the bed. Maybe you don't get any sleep. That first night that you try this, you might not get any sleep at all. Be careful. The next day, don't plan to drive anywhere. Cancel appointments. We tell people who are working, 5, 6 days a week, when you're trying to reset your clock, you've got to take some days off from work and responsibilities because it's a fact. If you haven't slept all night or you've dozed off a little bit in the chair a couple times, we don't recommend sleeping in the chair before bed either. People want to fall asleep in the evening, try to sit up and move around. Set an alarm clock in the evening to make sure you don't fall asleep before you go to bed. But in terms of getting up and being overtired, be aware that we can fall asleep with our eyes open. It's called a microsleep. We may not have any warning whatsoever. Eyes open, we can go into stage 1 sleep while driving, while standing at the back of a meeting, kind of staring, zoned out. It's momentary and it's dangerous. And certainly if the sleep hasn't been good, it can take time for this reset of the sleep schedule, the retrainment of the circadian rhythm to take place. But that wake-up time definitely is the key to the beginning of the whole change. So keeping the same wake-up time 7 days a week, and then slowly only getting into bed when you feel like you're really tired.
I agree 100%.
Good.
We usually do. Did that answer your question? Yes.
What about napping?
couple hours, you're off. Go back to sleep. You get up. During the day, you just get tired. You start napping early. Your thoughts on napping is at a specific time. You wait till late. I mean, at what point is napping productive or not?
Well, I'm going to go back 300 years and tell it. Well, my first answer is yes, napping is wonderful. But then how do we nap? How much do we nap? And what is synchronous with our lifestyle? Okay, so let me go back 300 years, pre-industrial age. Let's go any country you want to go to. Here's what a doctor would say. If you came to a doctor 300 years ago and you said you went to bed at 10 o'clock and you slept to 6:30, 7 o'clock in the morning, he would think you were abnormal. Nobody did that. Nobody. If you look at the past records in history, in physicians' periodicals, writings, in the literature of some great authors like Shakespeare and others, you will see that their pattern of normal sleep was, in those days, pre-industrial age, gets dark at 6 o'clock, you'd be in bed at 7 o'clock, you'd wake up at 12:30, 1 o'clock in the morning, you would have some awake time, maybe an hour, 2 or 3, you'd do a lot of chores, you'd go back to bed, and you'd wake up when the sun came up. That was called biphasic sleep. And there's polyphasic sleep. Actually, there's polyphasic sleep that's normal. In other words, think of a baby. A newborn baby sleeps, wakes many times through the 24 hours. That's polyphasic sleep. So biphasic sleep is actually what most animals do in nature. They don't have TVs and cell phones. They don't have electric lights. They have just day and night. And so that is a very normal pattern of sleep. It's not in our society since the invention of the electric light, TVs, cell phones, computers, all these things that keep us going way into the early evening and nighttime. So to answer your question, we're built to have biphasic sleep. I trust that all the folks at RIT there probably couldn't do that and carry on and get a degree, I bet. I may be wrong, but I bet it wouldn't work. I bet it wouldn't work for my profession. I bet it wouldn't work for many of your professions that you worked at in your working careers. So our human body is actually built for biphasic sleep. If you have the opportunity, I think it would work. And I know some people who do it and are perfectly healthy doing it. That's a long-winded answer to say a nap might work. How long the nap is, however, might also need to be adjusted. So if you're like the rest of us and have to be functional at 7 in the morning or whatever, 6 in the morning, you might want, and you want to keep your same bedtime as you have now, you may want to keep your nap short, 30 minutes maybe. You don't want to go much beyond 35, 40 minutes, because then you're getting into some deep sleep issues. It's hard to wake up from a nap when you go into deep sleep. So I myself take naps, and I think they're wonderful, and they help to keep me vital throughout a day. And so I'm all for it. But I think you have to be careful that if you nap too long, you're going to mess up your nightly sleep. Be a blessing. But it could also be a curse.
Late in the morning, early in the afternoon.
Yep. Timing.
Yeah, not taking it too late in the afternoon, but maybe in terms of before 5 p.m. You had a 30-minute nap. Late morning could be a time to have a nap, or early afternoon. I think of a nap as like, it's okay if it's not a patch for a bigger problem at night. If someone's starting to take naps twice a day, and the second nap in the afternoon is getting longer and longer and harder to wake up, you look at their sleep, when they're going to bed, how well they're sleeping. Not just, 11 to 7, 8 hours or something. It's the quality of the sleep that they're getting and what they're doing before they go to bed at night. So a nap could interfere, like falling asleep at 7 in the evening can definitely interfere with how well we're going to sleep through the rest of the night. That evening time is not good for a nap. Unless you're driving and you need to pull over and take a break because you're tired at 8 o'clock at night driving there, you pull over, take a nap, take two, a third one. Don't even drive if you're too tired. No substitute for rest when you're operating machinery. In terms of the nap, you have to think, because I don't sleep well at night, I don't get enough sleep at night, or the dog wakes me up at night, or my spouse is snoring, or my stomach is rumbling because I love to eat before I go to bed. We have to look at what's going on with the sleep at night. If the nap is part of a problem that naps have a purpose, use, and certainly if you're fighting the flu and you want to have extra sleep, but we don't want it to become part of a pattern that interferes with how well you sleep when you do get the majority of your sleep.
Perfect. Agreed. Perfect.
Good.
Yes. I, I think listen to your body always. Um, always listen to your body. If you need a nap, take a nap. Safety is of the utmost. If you're sleeping at night, fine, and you need a nap, you should take it. If your physician, you may want to bring it up to your physician, make sure there's nothing going on in the day to make you this excessively tired, perhaps, or maybe it's the medication. There's many things to think about, but definitely listen to your body, for sure. Well, there's a switch, you know. Neither have I. But there's no switch. That means you're normal. Everybody has those. It's like a long playing record in the background, and I'm bothered by that a lot of times, and that prevents me from sleeping well. I'll tell you the things that have helped me. One of them has been mindful meditation. I heard there's a program coming up. Go to it. Do it. I took a 6-week course in it on Saturdays, all day Saturday, for it was about 20 some years ago. It changed my life, and I wouldn't have believed it actually, but it really works. And I've had some trouble recently sleeping, and you know, this is how crazy it is. I was thinking of everything. I told my doctor, he gave me a prescription for a few weeks. I used it. It worked, but I didn't want to stay on it. And then I saw a program on meditation. I forgot about the fact that I did mindful meditation. You know, it's funny. When you're under stress, you forget things. And then I said, I was at this program. I said, you know how you have an aha moment? And so that evening, I went to the internet, and I got on my phone. I think it was a 20-something minute mindful meditation session, and I put it on as I was going to bed. I fell asleep before the tape was over, and I've used that now periodically. And so it really can help quiet that mind, which that's how minds work when you're idle.
I had gone to a meditation class one time because I was having trouble sleeping as well. I would fall asleep okay, but then I'd wake up like 3 hours later and couldn't get back. And one of the things that he had taught me was the chakras, because of energy in your body, breathe through them. So they're different colors, and so you start with the first chakra, and 12, you count to 12 while you breathe through that one, and then you go to the third eye, and then you go to the lips, and then you go to the throat. I could never get down to the bottom. I started doing this because right away, relax,
Yeah.
that's a great
Yeah.
example of mindfulness.
Yeah, it's powerful. And the beauty is nowadays you can Google mindful meditation for insomnia. That's what I did. And there's many choices. I've tried a few of them, and there's one I particularly like. But you know, you don't have to have ever meditated. It will talk you through, and I find it's been very helpful. And I agree with you.
Or talk a little bit about Parkinson's and
Oh, sure, sure. Sleep apnea is probably a hot topic, and it's so common nowadays. Uh, I started in sleep medicine in 1984, and I started with a colleague, Don Greenblatt, who brought the idea to me because he had trained in Miami, and he trained after I did, and they had a sleep center in Miami. And we saw this patient who was falling asleep all the time, and he was in the hospital, hospitalized for something else, but he was better from his illness, but they couldn't keep him awake, and he snored like a trooper. And one night, I think we were both there at the bedside, and we could see him go, snoring horrifically, and we could see he stopped breathing, and in a hospital, when you stop breathing, first inclination is to start to maybe even think of coding the patient. But he would then start up breathing. We watched this. And Don had mentioned there was an article of a case report. When you get a case report in the medical literature, it means it's kind of rare, unusual. And it was about this person who fell asleep and had this snoring and stopping breathing. They called it sleep apnea. And we had never really heard much about it, to be honest with you. And it was rare. We come to find out it's not rare. It's very common. But in those days, it was rare. There was no sleep center in town. There were only 2 sleep centers were in New York City. So Don said to me, why don't we start a sleep center? I said, what's that? He told me about it. And so we read about it, and we actually studied this person. To study this person, we had to steal stuff from the hospital. We had to go up and steal an EEG machine that neurology wasn't using at nighttime. We had to steal an EKG machine that cardiology wasn't using. We had to steal all this stuff because we didn't have rights. We didn't own this stuff. I was a lung physician as he was. And so we studied this person, and sure enough, he had sleep apnea. In those days, there was no CPAP. There was no treatment other than a tracheostomy. And actually, this man was so severe, his oxygen would plummet down. I don't think he would have survived. We actually did recommend, and he did have a tracheostomy, something we would never do today. And that got us to thinking that this sleep thing is really something. We thought it was a rare thing. And then a few months later, we had another patient in the hospital we were consulted on, et cetera, et cetera. Make a long story short, we decided to develop a sleep center, which we did. And we didn't have any designated space. They gave us not a closet. They gave us the ultrasound room to use until the morning, 8 o'clock. We had to vacate it. And the only reason we got the hospital to agree to a sleep center is we couldn't wake up a patient one time, and we couldn't get them out of this room. And they got upset. So they started to look at the real possibility of creating a center for us. And we became the 3rd center in New York State here at St. Mary's, where I was working.
I have about one more question, because I want to meet some folks who IT that are here recruiting program for Tai Chi.
Oh, perfect.
So, question.
Well, first off, it changes your life. And once you feel the effect of it, you'll want to. That you have to adjust to it like anything, but it's not difficult if you put the effort in. Usually the machines now are pretty good. So yes, you do have to use it the rest of your life, unless it's a reversible condition, like big tonsils in young people maybe, which we don't see hardly anymore. Or you lose a lot of weight and your neck is not so big and doesn't push in. You might get a reversibility or an improvement. But usually it's used when you sleep. And when you adapt to it, it's life-changing. So, oh, Inspire. Yeah, I'm too old for that one, so I'm going to give it to Jane.
So Inspire is just, so the question came up about what is Inspire? It's a new surgical technique to treat sleep apnea that's moderate, like 15 apnea per hour, or severe, 30 or more times an hour. And apnea or hypopnea are periods of not breathing adequately for 10 seconds. Oxygen level goes down, adrenaline is released, it's a whole stressful thing. So sleep apnea is air is not moving into the lungs signal the brain, and we produce adrenaline. Inspire is a surgical implant on the right side of the chest, connected to the hypoglossal nerve, and it makes the tongue push forward, back and forth all night in the mouth, or with the lips slightly parted throughout the night. In the morning, the person wakes up, they turn it off with a remote control, and they have had control of their apnea by this tongue movement, maintaining a tone at the back of the throat. So it prevents the airway from completely collapsing, which sleep apnea will do. If you fall asleep in a chair, we don't have a treatment going, we're collapsing back here, the most common type of apnea. Question about CPAP. Continuous positive air pressure. CPAP or BiPAP is just plain filtered air blowing in the nose or the mouth to keep the muscles open. When the muscles stay open, you can do the rest. You breathe normally, no snoring, and no apnea. Snoring is noisy breathing. Apnea is the real problem. And there's a 5-6 apnea an hour every night for 10 years. There's an increased risk of stroke and heart attack. So CPAP, BiPAP, positive air pressure, blowing moist filtered air into a nose or nose and mouth mask. A lot of different kinds of devices now, but that air blows in and just keeps the muscles open. This surgical implant called Inspire, the tongue actually pulsates forward. So it could work, and there's good surgeons in the area that are putting these in. You have to be evaluated first. Not for everyone, and sometimes certain cardiac problems may prevent someone from having Inspire.
Before we close, or before I get the hook, I want to give a plug for what I see in the future for healthcare in particular, and that is preventative medicine. And I say that in the sense that we've gotten very good at treating illness and helping people with all kinds of modern maladies. One of the things that I see in the horizon, and Rochester is a mecca for this, is a thing called lifestyle medicine. And that is to prevent and keep us healthy as long as possible. And we are a mecca. And that little paper that you have in that little handout, the tiny sheet, is giving you the information of the people here in our town who are in the forefront of teaching us how to have a healthy lifestyle. And lifestyle medicine, I think, is something that everybody can benefit no matter where you are in life. So I'm going to endorse that. I have nothing to do with it, but I am a recipient of it. Actually, I'm in 2 of the programs of lifestyle medicine myself. I've taken their course on a healthy diet a number of years ago, and I'm in the LIFT program, which is a program that, like it sounds, gives you a lift and helps you to really enjoy your years and enjoy your life. And gives you, it's a 10-week session for an hour, and it has a workbook associated, and it's wonderful. I just began it, and I think it's going to improve my life a great deal. And I think that is the forefront and the frontier. keeping us well before we get sick and maintaining us when we are sick. So I endorse that 100%. And I hope you find, if you're interested, I hope you see it as, and see the benefit as much as I have. I will end with that. We'll be here putting stuff away, I think. And if you have any other questions, and the sheet you have my email address. You can email me and I'll be happy to respond.